Well, welcome back to our third speaker, and we're very happy and pleased to have with us Marie Hilliard. But before I introduce her, I just wanted to mention that several of our board of advisors for Integritas are here today, and I would ask them to stand, if you would, just to recognize our gratitude for their advice and counsel. We already introduced Dr. Schorsch back here, and then we have in the back of the room my old next-door neighbor, Martha Vialba, who has been very helpful with her time and input. And then Rebecca Davis-Mathias has been helpful with us too. She's at Dominican University. And in the back here, who somebody's hugging aggressively, Dr. Mary Keene, a longtime friend of Integritas and of the Catholic Medical Association here in Chicago. So if you'd give them a hand for their support, we'd really appreciate it. I don't know whether to call Marie doctor, counselor, nurse, sister, friend. She's well qualified, and I'm a Jesuit. We're sometimes accused of collecting a lot of initials after our names, but you can see PhD, a Canon law degree, the MS, the MA, RN. So we've been lucky and diverse here to have nursing, medicine, pharmacy represented at the podium. One thing which Marie brings is she's a great Irish storyteller. I don't know if that's going to be part of her presentation today, but I was happy to be at a conference with her where she was able to flavor her presentation with some helpful anecdotes. She has graduate degrees in Maternal-Child Health Nursing, Religious Studies, Canon Law, Healthcare Administration, and I'll just highlight one or two of the projects she's worked on. She's the former chair of the National Advisory Council of the U.S. Conference of Catholic Bishops and serves on the review board for the protection of minors in the Archdiocese for the military service. And I'm ex-Army myself, so we're always grateful to recognize the public service of a leader. She was an officer serving many years and decorated for her service. So I'd ask you to welcome her to the podium with a round of applause, and we look forward.
Thanks very much, Father, for that very nice introduction. Father and I have presented together for the bishops of this country through the National Catholic Bioethics Center, where I serve as Director of Bioethics and Public Policy, which I think is one of the reasons I'm here. But I also said to Father over lunch how I feel like I'm the mama bear because your two previous presenters are graduates of our certification program in bioethics at the National Catholic Bioethics Center, and I'm just so very proud of you both. You just did a phenomenal job of setting the stage for what I'm going to try to wrap up for us. And in a more global way, what we're facing, and then we'll have the panel for you to ask more questions in relationship to these topics. But you might ask, as many people do, well, really, as licensed healthcare professionals, which I am, and I'm actually, because of the military, I'm licensed in 5 states. And I keep getting notices if I want to be a travel nurse because they can see where I've been licensed. And do you want to be a travel nurse? And I travel enough as it is with my job. But licensed in many states, and well, then aren't you just an agent of the state? It's talking to me too, giving me the time, just like it did to you, Nicole. Aren't you just an agent of the state? And really, how can these issues of faith, religious freedom, or even conscience protection, how can they impact your care? Because you really are agents of the state. So I'm going to speak to that, but speak to that in a way that actually is very rational. And we talk about the concept of natural moral law. Paul defined it very well when he talked about how the Gentiles were good to each other. And look at them. Why is that? They don't know Christ. They don't know a deity. They're pagans. But there was something written on the hearts of the human person. When I try to explain this to my little nieces and nephews, and I'm not a sister, never have been, but I have 5 brothers, so I have 32 nieces and nephews, and I'm somebody's sister. But when I try to explain it, I'll say it's like the ick factor. like if we're talking about now the 3-parent embryo that I'll be testifying down in Washington in May on, where children are really being commodified. And when you really explain what's happening, and when people understand the techniques that are being engaged in, it's like, ooh, Aunt Marie, that can't be okay. But it's there for a cure of mitochondrial diseases, so it sounds so good. So there are things that are written on the hearts of the human person, regardless of the faith community or lack of, that need to be protected. Because I've given you a handout, you have it in your folder, you don't have to pull it out now, but this is written about moral distress, which I'll be talking about in healthcare, the moral distress of the provider when they're told that they must violate a deeply held belief. And there's research, actually, this is from a non-faith-based association. It's from the American Association of Critical Care Nurses, how they define moral distress as what occurs when you act in a manner contrary to your personal and professional values, which undermines your integrity and authenticity. And then this article, which was written by the National Catholic Bioethics Center, who looked at different impacts upon professionals, speaks to what happens to nurses, which I am and have been. I didn't retire from the military until 6 years ago, so and I've always worked. As I work in this position now, it does involve the practice of nursing, but always, most of my healthcare career, except for 9 years where I taught at a Catholic hospital, has been in the non-Catholic arena. I was director of the state licensing board in Connecticut for 12 years, which was the Board of Examiners for Nursing. That was my full-time job. 20 years in the military. So a lot of my background is very similar to our speakers. So, well, how did I navigate those, and was it important to navigate them, and what happens when in those secular environments, or even in a Catholic environment or a faith-based environment, one feels in which their own integrity is being compromised? And the literature shows that what happens is we begin to tune out. We're not going to be patient advocates, which we need to be when we see something like that 60 milligram dose of morphine being ordered. We're going to become actually they talk about depression, and we then become just what we call vending machines, where people think they can put money in and we're going to do what they expect us to do, which really is almost like a form of prostitution. It really is, and what it does to the human soul. So this is very, very important in terms of moral distress and the protection of conscience. It goes on in this article, which you can read later, to talk about what happens to physicians. And what happens is they begin to engage in just what's legal. And what becomes legal is deemed as ethical. And then you see a terrific amount of defensive medicine and care that's really futile, which really tears at the soul because you're hurting the patient that you've been asked to protect authentically. So I'm going to talk about the history of healthcare and how important it is to understand from where we come. It's a ministry. The state says we're agents of the state, but our whole history is one of ministry. And we have to be able to protect our integrity, the integrity of our souls, or the people we serve are going to be short-served. And in fact, there's going to be erosion of that beneficence that Dr. Perucci talked about this morning. We're not going to do it anymore. We're just going to cover ourselves. And we're actually going to, we're finding depression ensues also. So, if we can look at the whole history of healthcare, the historical fact is that healthcare, if you look at its history, the history is synonymous with the history of Christianity. But it actually goes deeper than that, and I'll talk about the Hippocratic Oath, the original, true Hippocratic Oath, which no longer is being cited in our medical schools because there are some things that Hippocrates, who wasn't a Christian, he was a pagan, heralded by the anthropologist. Most of you in this room are too young to know Margaret Mead, but heralded by Margaret Mead, not a Catholic from my understanding, who said this was a very important time in history where the healer was no longer going to be also the sorcerer, because before Hippocrates' time, before Christ, who obviously Hippocrates wasn't a Christian, the healer was also the sorcerer. He would put to death, as we're seeing now in 3 states, and I'll touch on that also, and It's progressing again because of the Brittany Maynard case. Although I will say in every state where there's been a vote on it this year so far, it has failed, which is the good news. But in any event, certain things that are written on the hearts of the human person, we could see from Hippocrates, a very, very important point in time. And then comes Christianity. And the whole history of healthcare, the organized system of healthcare, is the history of Christianity and the Catholic Church. And it comes from, if we look at the imperative in the gospel, I call it our orders, if you will, our charging orders. I was 20 years in the military, and our orders to go out, not just to evangelize, but through our service to heal. And it's the parable of the Good Samaritan. Now, there are a number of people involved in the Good Samaritan. You remember the man who was beaten on the road, who was a Jew. Who was the first to pass him by?
Priest.
Yeah, a rabbi, right. Someone of his own faith persuasion. And then the next, right, who worked in the temple, the Levi passed him by. And the third one was the Samaritan. And what did he do? He helped. Yeah, he not only helped, he brought him to the inn, and he said, take care of him, I will pay you what it costs you, and I will come back and I'll reimburse you. Do you remember what the question Jesus was answering when he gave this parable? Who is your neighbor? That's right. Who is your neighbor? Dr. Dietz, right? Is that, yeah. Who is your neighbor? And basically, the Samaritan was the dreaded, despised member of a sect of Judaism, and this is the person who stopped and treated the Jew. But the final statement is the most important statement in this parable, which is right there. Go and do likewise. And that was our commissioning, our great commission as healthcare providers. Go and do likewise. So in our emergency rooms, we don't look for baptismal certificates. We'll look for an insurance card, but in Catholic hospitals, we don't look for baptismal certificates to determine who we're going to treat and not treat. We're going to treat everybody. It's a ministry. We were in this ministry long before any governmental agency was involved. And yet we're being treated as if we are agents of the state, and therefore the thou shalts that Dr. Perucci talked about in terms of the law now directs your care, and autonomy also, as she pointed out. And then the classic examples in pharmacy that we heard from Dr. Alcox. So if you look, and I don't need to go through all this history, but if you look at the first, in the textbooks, the first organized form of nursing care, St. Benedict in 500 AD. I taught nursing. I ran the 11 schools of nursing for the Army. And in all the secular textbooks, it's cited. The first documented organized system of nursing, St. Benedict. And if we go on to the Crusades, which are right now getting a terrible rap, but the basic happenings during the Crusades were that the Muslim community was taking over the sacred spots in the Holy Land. And to protect those spots, the Crusades occurred. But the Knights and Dames of Malta, then Knights, now Dame. Any of you in Malta? Great humanitarian organization. I'm a Dame of Malta. We take patients to Lourdes every year and their loved ones. We take hundreds of them, and we care for them. And hope for spiritual or physical healing. But a great tradition, and that's tradition was to care for the pilgrims, the hospitalers, care for the pilgrims. Textbooks cited as the first organized system of healthcare delivery back in the 1100s. There's other stats there, but if you then look at what happened during the Middle Ages, and what we talk about how the monasteries protected civilization, because all the great books were the scholars photocopying by hand, if you will, all the long before computers, the great scriptural text. But there was another thing that was happening in those monasteries. They were your local hospitals. And the brothers, mostly brothers but sisters too, were taking care of the poorest folks in the area. Of course, it was all pro bono. And when the Reformation came and the monasteries were suppressed, it was really the Black Ages in terms of health care. Awful, awful care. And that's when Florence Nightingale came on the scene. Florence Nightingale spoke to how God spoke to me and called me to his service. She is the founder of modern nursing education. Phenomenal woman. And she was called to Crimea, and she had Anglican and Roman Catholic nuns. Do any of you watch Call the Midwife? Yeah, those of us who are nurses, and I'm a pediatric nurse, a graduate of Children's Hospital in Boston. Those are Anglican nuns there, which it's in the 1950s. You would assume from their habit that they were Catholic nuns. But both Anglican and Roman Catholic nuns went to the Crimea with Florence Nightingale and reduced the death rate. When she arrived, Florence, it was 42%, reduced it to 2% in 2 months by the nursing care that she provided. But she felt called. It was a ministry, a vocation. Granted, she was doing it for the government, but she was unimpaired in terms of what they were. If you read the actual history, and I've read her book, she talks about how at first she wasn't too well received by the physicians, but when she demonstrated her skills and what she could do to help their patients survive, she was truly well respected. Right in our own country, and not too far from here in Indiana, there's the Sisters of the Holy Cross that run St. Mary's, the university near Notre Dame. And those sisters were called into action by the governor in Indiana to help treat the wounded in the Civil War. And interestingly, some of these sisters were not nurses. And a couple of the sisters were put on a Navy ship. And in the textbooks, they are defined as your first Navy Corps nurses. And actually, there's a war memorial in Washington dedicated to the 12 religious communities they're mentioned. But interestingly also is 2 of those sisters received military pensions back in the 1800s because of the work they did. So the ministry of healthcare, we're not agents of the state, although we have to be licensed and we have to be competent. We have to be able to give that beneficent care. We have to be credentialed. And we have to make ourselves invaluable. And quite frankly, that's exactly what Nicole and Robin have done. They're in secular environments. They're skilled. They have integrity. They've made themselves invaluable. And that's where our charge is also as healthcare providers, to be the best that we can be so that we can do the job that needs to be done in our healthcare ministry. Father says he's going to New Orleans soon, and the Sisters of Charity, they were commissioned by the government in 1832 to take over the public hospital, which they had in New Orleans until 1970. It was like your Cook County, thank you. And we passed by the building as we were coming here today from the hotel. Exactly. Catholic sisters running a public hospital. First hospital west of the Mississippi, St. Louis, Missouri. It was Sisters of Charity, Elizabeth Seton's hospital. So, and now, if you look at our significance as Catholic healthcare providers in terms of institutional care, we're the largest non-governmental provider of healthcare. We're the largest non-governmental provider of healthcare in this country. The Catholic Church is 642 hospitals, and actually some of those are systems, so it would be more hospitals than that if you looked at the hospitals within systems, serving 5.4 million overnight patients, but over 100 million outpatient visits per year. Over 100 million. We employ hundreds of thousands of employees, and our long-term care facilities, our home care, our hospices, you see the number there, over 1,500. We're the largest provider, and yet when I get to talk about the mandates, and especially the Affordable Care Act, and I was very interested in your question about what would we want to change if we could change. And I write testimony all the time for the National Catholic Bioethics Center because I direct the public policy office. But there's some really bad mandates in there. If somebody gets re-hospitalized in 30 days under Medicare for the same diagnosis like pneumonia, well, those of us in healthcare know, what do elderly people get? Pneumonia. They're penalized. Their Medicare reimbursement will be penalized. Hips, fractured hips. That's what our poor cardinal had, a fractured hip. It was shown on the media last night in his long journey unto death. heroic death. Knees, those are the things that the elderly have problems with. Readmission for these things within 30 days, you're penalized. Now, what does that mean? We're going to start rationing health care to the most vulnerable, because we're vulnerable at the beginning of life and at the end of life, as we heard Nicole present. So there are a number of things that we in institutional life, as well as individuals, which Nicole presented so well, are needing to address and needing to have our, I think the expression was, head out of the sand, so that we can be the advocates, because when we are silenced, we're not going to step up. We're not going to report that doctor who ordered the 60 milligrams of morphine, and our patients are going to suffer. And quite frankly, I think people are already feeling very vulnerable in terms of health care, like the dollar is driving their care, not their one-on-one relationship with their physician. So we talked about the beautiful oath of Hippocrates that the National Catholic Bioethics Center had to basically refine, because the true oath is no longer being spoken in our medical schools. Hippocrates, again the pagan, I will give no deadly medicine, even if asked, nor counsel any such thing. I will not give a woman a pessary to induce an abortion, or any drug to induce abortion. Not said anymore. And the sad thing is, when we look at states in which assisted suicide has been legalized, I don't know of one state, and we testified a couple of weeks ago in Connecticut where it failed, and 2 months ago in Maryland where it failed. When you look at the testimony coming in against assisted suicide, the State Medical Association is always there. But once it becomes legal, as it is in Oregon and in Washington and Vermont, and there's 2 other states in which there are court cases that the courts have ruled, but it's gray in terms of what's actually happening there. But once it becomes legal, what about the ethics committees of the American Medical Association at the state level? Why aren't they not intervening and saying, well, wait a minute, you can't participate in this? And they're not. They're not, even though we have statements about the non-use of lethal drugs. And again, it seems to be selective in terms of what the professional associations will support a practitioner in, and then I'll be addressing that also. Conscience, and we heard some questions earlier today about, well, should we just be protecting persons based on faith systems? Well-informed conscience, and that's the key. A well-informed conscience is one that should be respected. And the examples of vaccinations that Nicole referenced, there are a number of parents, we get it all the time at the beginning of a school year for our Catholic schools, in which parents are saying they want to be able to opt out of an MMR for their children coming into a Catholic school. And why isn't the Catholic school saying, I can opt out because our faith should not allow children to be vaccinated with a vaccine that is derived from a cell line from aborted fetuses decades ago? And Nicole presented very well the Church's position on that in terms of the degree of cooperation. It's remote. It's for a proportionate reason, which of course would exist here, especially with the measles outbreak. But we're finding parents getting very angry at bishops. Well, wait a minute, why shouldn't you let my child come in? When, of course, there's a public health risk right now also. But the Church has said, based on informed conscience, religion, in our case where we've looked at all the science and the level of cooperation that's involved theologically, that it's morally licit in the absence of an alternative. You present your objections that Merck or other companies, and some of these vaccines are produced by Merck, to them, as we have, that they provide other sources. But a well-informed conscience, even if it's not articulated as a faith-based conscience, a very good atheist could say, gee, as many do, abortion is the taking of a human life. But it has to be a well-informed conscience. And I think that's where we have to draw the line, that it can't be today my favorite cause is X, Y, or Z, and it might be different tomorrow. But we do respect conscience, and a person must not be forced to act contrary to his conscience. It's in the Catechism of the Catholic Church, more lengthy here, and you do have copies of my slide. But the key is it has to be a well-informed conscience. It isn't one in which I'm going to hold out for this today and something else tomorrow. It's got to be based in what we call natural moral law. My mother had this great, I guess this is where the storytelling comes in, as Father talks about. She lived to be 98, and she had her mind till 5 days before she died. And she was a very wise woman. And we'd talk a lot because she was an elocution teacher and I was a lobbyist for the bishops in Connecticut. So I'd be on television a lot, and I'd have dinner with her every night and put her to bed before I would have to go back to the Capitol, and she'd tell me how I did that day or not did. But she would say, you know, Marie, sanctity is sanity. Sanctity is sanity. I never once in my 10 years of lobbying for the bishops had to use an encyclical, a papal document, or the Bible to express why certain things were not good. Natural moral law written on the hearts of the human person. We can explain it. Faith and Reason. You have a wonderful document, encyclical on your table, Faith and Reason. But again, the conscience has to be an informed one. It has to be based in reason. As I was lobbying, and I'd have to travel a lot because I was on the board of the National Association of State Catholic Conference Directors, and I'd be sitting on a plane, and people would ask me, you know, what do you do? And usually I'd start with, I'm a nurse, because it's a good moment for catechesis, but there are some times where you know what's going to come when you say you're a lobbyist for the Catholic bishops. And the only reason I was a lobbyist was because the law requires me to register as a lobbyist, and I have to do financial reports every month to demonstrate that I'm not trying to influence through economic ways what's going to be voted upon. So I'd be sitting and saying, well, I'm a public policy person for the bishops. I do lobby. And they'd say, oh, this would be a Catholic sitting next to me. That's a violation of the separation of church and state. Nothing could be further from the truth. But that's the way things are moving, as Robin and Nicole both presented. That's the way things are moving. What happens inside the church is supposed to be okay, but what you bring to live your faith in the common square is not okay. And it's a real misunderstanding of the First Amendment of the U.S. Constitution. And the First Amendment talks about there'll be no established religion. It's called the Establishment Clause. And it means that we can't be like Iran, the state religion being Islamic. We can't even be like Great Britain, where the Church of England is the state religion. We don't have a religion that's the state has promulgated as its official religion. But the second prong is equally important. In fact, there are constitutional law professors who are not Catholic who say it's more important, and it's the Free Exercise Clause, that we have a right to live out our faith in the public sphere. And for people to say, as Nicole mentioned, you can't be a pharmacist if you're going to have faith beliefs that are going to interfere with the autonomous desires of the patients you're serving. We hear that over and over. We run a consultation service, by the way. We get 2,000 calls or emails per year from our consultation service. Absolutely free. Absolutely free. I was on it till Monday morning at 9 a.m. Absolutely free. And the credentialed ethicist is available. And we get 2,000 calls. But increasingly, we're getting calls from pharmacy students, from nursing students, from practitioners, from even those, and I'll talk about those who work in labs with biological material from those same sources that Nicole mentioned. And people are basically saying, well, if you're not going to be willing to assist in abortion, you can't be a nurse. And that's the direction in which this country is going. And that's exactly what this First Amendment Free Exercise Clause was to protect. But it's being flipped and used against us in healthcare. And we really have to be diligent. And you heard from Robin how she gets herself on committees. I mean, how important that is. Professional committees, not Catholic committees, professional committees, because these are not just Catholic agenda. These are things that are written on the hearts of the human person, critical to our profession. We have to be there. We have to be there. Or we're going to be like the Netherlands, where they moved into assisted suicide. Now, parents, can euthanize their babies. It's legal in Belgium and in the Netherlands. Parents can take a look-see at their baby, decide whether that baby's going to live or die, and actually euthanize their baby. That's where it moves. That's where it moves. And Canada, just by their Supreme Court, just a 9-0 vote, I understand, approved physician-assisted suicide. And now there are professional organizations that are saying that if physicians aren't willing to do it, they must refer. And Nicole gave a great explanation of the difference between referring and transferring a care. Excuse me, the patient's body and their record belongs to them. You're just transferring care. But it'll be thou shalt. And that's what we're seeing now. And I'll have a great example, and not a good example, an accurate example of what's happened to nurses in terms of abortion. Okay, so we find that society is redefining this ministry, and actually there's an agenda which I think was laid out very well by Nicole in terms of why are they singling out. And she talked about people sent into pharmacies to try to trap pharmacists. Why is this particular drug being singled out? Ella is clearly abortifacient. It's very similar to RU46 in terms of its makeup. But there is an agenda out there, and contraceptive mandates, we have 20 states in which there's a mandate in emergency rooms. Now, interestingly, because of what's happened in Illinois with pharmacists, I was surprised to see that in Illinois, the emergency room only has to provide information. But in a number of states, even Catholic hospitals are being forced to give emergency contraception to sexual assault victims on demand. Will we give that medication morally and licitly? Yes, if we can do a good history and physical and appropriate testing to make sure we can stop, we have the prudential certitude that we can stop ovulation, because the drug also has an impact. It says right on the flyer from the FDA, it can prevent implantation of an engendered human being, the embryo. If you read the literature, it says a fertilized ovum. Fertilized, it's euphemisms. When we use language to make the unacceptable acceptable, it's because we have to deceive that heart in which certain things are written upon, because we are human beings, natural moral law. We also have, as Nicole presented so clearly, the burdens put on pharmacists. And it's really interesting if you look to see how this evolved. The levonorgestrel is the acting drug, and I have no financial interest, as I have to tell you, in any pharmaceuticals or pharmaceutical dispensary, but the active drug, levonorgestrel, which is in what's called the morning after pill, initially it was prescription only. And then it could be dispensed by the pharmacist. And then it became dispensable to a 17-year-old. Now it can be at any age. But here's the rub in terms of bad law. Male or female. And you can just see where the agenda is. Well, this is bad law. You can have the statutory rapist who is 25 years old, who had consensual sex with a 15-year-old who thinks she's in love with this man who has taken advantage of her, getting that drug over the counter, and the statutory rape is never exposed. Really, really bad law, because it's male or females can get that particular medication. And you have pharmacists.
45.
Pharmacists are saying, hey, wait a minute, this is not okay. And it could be based on conscience, not a religious, but informed conscience objection. And you see the state, Illinois being one of them, as Nicole has covered already, in which a pharmacist, as if they're a vending machine, must fill every legal prescription. Well, you're really supposed to know why you're giving this and whether it's good for this particular scenario. And then there are very few states that have good conscience protections. There's 6 of them there. Then she's already laid out the scenarios that are being lived out in Illinois and continue to be lived out in the state of Washington. And these are the 2 cases she mentioned. I think it's really interesting if you look at the court decision in the Washington case, now that court is not a particularly conservative court, but what the judge said in the finding in that decision was, wait a minute, why are you making this drug be stocked in this pharmacy, family-owned business that objects on conscience, but a low-volume dose, a low-volume medication that doesn't have much turnover down the street in another pharmacy, they have no obligation to stock that. So you are clearly discriminating based on faith because this drug is readily available, just go down the street. But because the objection is faith-based, you're saying they don't have a right to it, where the economically based objection you have no objection to. And it became clearly evident to the court that this was religious discrimination. Now here's where those of you, how many of you are nurses or nursing students? Not too many, okay. But no matter what, in terms of if you're interested in healthcare, these scenarios are getting played out. A nurse in Louisiana, Tony Lemley, lost her full-time job for refusing to administer the morning after pill. Second case there, Kathy DiCarlo, this is Suzanne DiCarlo. Very tragic case, was forced by Mount Sinai Hospital to assist at an abortion when she was an OR nurse, had given all the appropriate notice, even before hiring. She had said, I won't do this, you need to know I won't do this. It was a non-emergent situation. They had like 6 hours to find another nurse to do it, and they told her they're going after her license, that this would be negligence, and she did assist. And then when she went to sue, the only one that it was illegal. What they did was inconsistent, because there is some federal law that does protect us as nurses in terms of abortion. But the only one that can go after the hospital is the funder of that hospital, which is the feds who give the money. So when she tried to go after the hospital and say, well, wait a minute, you violated my rights, she had no right of action. In Long Island, the Nassau University Medical Center was trying to tell, they'd actually started to discipline 9 nurses who refused to assist at abortion. And there's a picture of those nurses, and the ethnic diversity of them would indicate to me they weren't all of one religion. I don't know. Luckily, their union went to bat for them. Luckily, their union went to bat. They weren't holding out religion, they were holding out conscience at that time, a well-informed conscience that knows from the moment of fertilization that's a human being. And in New Jersey, a similar thing, and this was a state-run hospital in New Jersey that tried to force nurses to assist at abortion. These are very current cases, and if you need the case law, we have it. End of life is what the new mandate will be for us, because as soon as it becomes across the country assisted suicide as legal, then it will become mandated, because that's what we're seeing, and that's where we all become at risk. Be we pharmacy techs, pharmacists, doctors, nurses, and then it moves into active euthanasia, where there's the actual administration of the drug by the provider. Interestingly, the Supreme Court has held in a case that two cases that went to the Supreme Court, that at the federal level, there's no constitutional right to assisted suicide. So where it's getting played out now, right now, this year alone, there are 15 states that have been hearing bills to legalize physician-assisted suicide. And luckily, to date, in every state, so far, where the vote has been had, or they've met their deadline for acting on a bill, it has not passed. We're very worried about California, and we're very worried about New York, where it's still quite active. We've already talked about the states. I won't even go into Montana and New Mexico, where the courts have decided. In New Mexico, the Attorney General is appealing that decision. But these are all the states. Actually, Connecticut has now moved down, since I even wrote this last week, it failed there. But a number of states. And it's all dressed up as the good. The Brittany Maynard case is the case in which, that young woman with the brain tumor, you remember she had a grade 4 glioblastoma, which one of my brothers died of. And I watched his children who were in college, and his youngest was 8, diaper him and care for him until death. And actually, it's interesting. I've never been married, so I don't have any children. My healthcare agent is one of those, she's now an adult woman, a married woman. I watched as she cared for her father, diapering with the man she eventually married, who was a college student. Most college students would have been out the door with a scenario like that, having to diaper an adult. And so these are my healthcare agents, because I watched as they cared for folk, for their loved one. But we have to be very, very concerned because of our own well-being, not just as providers, but what will we be facing? And Robin mentioned about we're all going to be healthcare consumers, and we all are going to be subject to a healthcare system that can lead to pause. Like, are we going to have now a violation of informed consent in terms of it's costing you too much, and there's a factor, just like the factor for the computer for the neonate, there might be a factor for the elderly. Oh, they're going to cost us too much, so, they're going to live another 6 months if we give them assisted nutrition hydration, but they're costing us money. So maybe we need to say we're not going to provide that anymore, or reimburse that. The American Nurses Association just revised their code of ethics, and I was on one of the review panels for it. Didn't get everything I wanted, and this is of concern to me. There are some good protections for conscience rights, but some of the language is of concern to me, because it says here, where a particular treatment, intervention, activity, or practice is morally objectionable to the nurse, whether intrinsically so or because it is inappropriate for a specific patient, or where it may jeopardize both patients and nursing practice, the nurse is justified in refusing, etc. The problem is the word intrinsic means inherently, in its own nature, which means that they would say, well, this is legal, it's not really. You could have someone saying it's not, therefore, something, your personal view of abortion, because it's legal, it's not intrinsically wrong. Intrinsically means it's always wrong under all situations. And that's a problem there. And then it goes on to say, conscientious objection may not insulate the nurse against formal or informal penalty. That should say should insulate the nurse, but it says may not. So it is of concern. There's some other good things that we haven't fully analyzed this. But here's where other professional organizations are letting down also, not only the profession, but other professions. And this is, as Nicole talked about, pitting one profession against the other. The American Medical Association Board of Trustees, the American Medical Association is telling pharmacists what they should do. Supports legislation that would require individual pharmacists and pharmacy chains to fill legally valid prescriptions, etc. Basically, the doc saying to the pharmacist, thou shalt. The OBGYNs, the burden they put on their own members. This is ACOG, the American College of Obstetricians and Gynecologists. Conscience can only be accommodated if the duty to the patient is met. What does that mean? You must always provide like a vending machine. It goes on to say, physicians may refer, and Nicole had basically, it's like being a hitman. You're going to ask someone else to do what you won't do. And in fact, in secular law, when you hire a hitman, the penalty is even higher. That's the way secular law is written. But here it is, well, you must refer. But then it gets worse. You are to locate your practice if you are in a resource-poor area, meaning where other abortionists won't practice. You are to locate your practice near someone who will do what you won't do. So basically, they're telling you where you must practice if you are a conscientious objector. And in emergencies, physicians are to act against their conscience. There was, and I have to 110, I think, because we started late, if I'm not mistaken, because I'm trying to pick up some of the things that I heard this morning. There's much misunderstanding about what we call the principle of double effect, and I think it has great applicability under some of the questions, one of the questions that was raised this morning. You can have a woman, and I think a very good example of the emergency, a woman whose water has broken, baby is before 22 weeks. You could also have a woman who has preeclampsia, which is a hypertensive crisis, and it's believed that the placenta is the source of the pathology. It hasn't implanted correctly, and toxins are being released. So in either one of those scenarios, baby is not viable. You do everything you can to try to treat the infection or the hypertension to get baby to viability. But you get to the point of no return, and you're going to lose both mom and babe. Is it morally illicit under the principle of double effect to try to expel the pathological tissue, which is either the placenta or the membranes? Not do a D&C, which is what is often sought, because that dismembers a baby alive. But using a drug that would be used to induce labor under the principle of double effect to remove the infection which the baby is sitting in, even though you know there can be two outcomes. One is intended and a good, and the other you can anticipate, but you don't will. It's like when you have to give high doses of pain medication to someone who's gotten attenuated to higher doses of meds. They're in their last days of life, and they're trying to control pain. So the principle of double effect, where you can't pass go, is where the act itself is an evil act, and the act of a D&C would be a dismembering act. But inducting labor in that emergency situation where you know the baby's going to die because the baby's not viable, but you're trying to get the baby out of a pathological situation in that womb because of the pathology of the reproductive system, that is morally illicit. Proportionate reason, you can't wait, you've tried treatment. But a good effect can never result from an evil effect. That's why the D&C, which is going to be clearly a bad act, even though you might save the life of the mother. But there are other options, and even in an emergency. And so the act itself, it can never be an act of direct attack. And that's beautiful, beautiful, and really tough sometimes. We sometimes have like 15 minutes when we get the calls. But I think, quite frankly, those scenarios where that the conscience is going to be, in an emergency situation, going to be challenged, we might get the calls, but those, usually your Catholic hospitals have good policies in place to address those. Okay, this is really hard to understand. These are religious leaders. The group is called the Religious Coalition for Reproductive Choice, and they admonish that the law should not be overridden by positions of conscience that are based on religious beliefs. These are a group of clergy who have given this statement. And then we get calls from biomedical researchers, especially men and women who are studying, and they might be in their master's or doctoral programs. They're in the middle of a project, and they might realize they have one of those four sources that they're working with in their biomedical research that came from aborted fetuses decades ago. And there's a beautiful document similar to Humana Vitae. It's actually been to address issues of fertility as well as embryonic stem cell research. It's called Dignitas Personae. It's from the teaching authority of the Church. And it talks about even these scenarios, that there's a duty to refuse to use such biological material, even when there's no close connection between the researcher and the actions of those who perform the artificial fertilization or the abortion. But it then goes on to say, and I think it kind of cut off here, but the responsibilities of those who make the decision to use them is not the same. To use those materials is not the same as the responsibility of the bench scientists. So what we advise those, they might even be medical students, is you're in the middle of a project, state your objection. You're not the one who designed this. You're not the one who brought in those materials. No new abortions are occurring. Make sure you're clear that you won't be involved in this again, and finish your project. Because there can be proportionate reason for them finishing. It might be some good, clear research that's going to help folks and help them to get into the workforce and make good bioethical decisions. Then we have what we've heard earlier this morning about the Affordable Care Act, and there are many good things, many good things in that act that we want to go forward. I sit on the board of the National Catholic Partnership on Disability. I chair their ethics committee. And there's many good things in there in terms of providing care to people who would otherwise not get it. But there's no Hyde Amendment. The Hyde Amendment says that there'll be no public funding of abortion. There's limited conscience protection in terms of abortion, but not abortifacients, drugs that are called contraceptive but really have abortifacient potential. There is protection in terms of assisted suicide, but if you look at the laws in Washington and Oregon, on the death certificate, they can't say assisted suicide killed a patient. And then it goes on to say, this is not suicide for purposes of the law. And in other words, you can still inherit, you can still be the one who coerced your family member to take the drug, because there's no witnessed, there's a witnessed statement of consent, but then the drug, it might be taken 2, 4, 6 weeks later, no one required to witness the ingestion of that drug. What if someone has changed their mind? You have no idea. But the point is, pharmacists, in terms of, and it gets to your point, Nicole, will they really be exempt as it starts crossing the country, if it does? No Church Amendment, no Weldon Amendment. Those are two conscience protection amendments that should have protected that nurse DiCarlo that didn't in the Affordable Care Act. And then we get the contraceptive mandate that mandates that every employer with more than 50 employees, or any employer who gives health care coverage at all, must provide sterilization coverage, but only to women. Isn't that interesting? Only to women. Contraceptives, including intrauterine devices, which are clearly abortifacients, and the morning after pill. And if you provide such insurance and don't do it, you are fined $100 per employee per day. And that's what Hobby Lobby and Conestoga Wood Companies objected to, because they didn't want to provide the morning after pill. They didn't have trouble with contraception, but they didn't want to provide abortifacients. Luckily, that went to the Supreme Court, and their rights were protected. But even faith-based entities are obliged to do this, and there is supposedly a carve-out. You can be accommodated. The only faith-based entity that's exempt is basically a parish, a seminary, maybe the chancery. But a hospital is not exempt. Catholic charities are not exempt. Adoption service is not exempt. You're accommodated, which means you sign this piece of paper and you tell your insurance company that you're paying the premiums for, that you want them to provide it to your employees, which gets to cooperation. And your employees get 2 insurance cards from the insurance plan that you pay for, one for their contraception and one for their other coverage. And again, there's a whole issue. Is abortion, are there plans that provide abortion on demand covered? Yes. But then there's this bookkeeping thing that's supposed to isolate out that money, so you're really not using public money, which has already been demonstrated to be ineffective by the government's own accounting agency that looked at it. So there are a number of problems with it that are really based on violation of conscience. We have the Little Sisters of the Poor. They run wonderful home long-term care facilities, and they said, wait a minute, you're telling me I have to have this insurance plan, I pay for this insurance plan, supposedly my premiums are not going to be paying for the contraception, but I have to tell my insurer to provide it to my employees? I'm not going to do it. They had their last day in court before we think it eventually hit the Supreme Court, depending on what the 10th Circuit, on December 8th, and we're waiting for a decision on that. Right now, they've had an injunction, and many of these cases have received injunctions when they've been pushed forward. A number of them are going to get to the Supreme Court. 31 out of 40 cases have been getting injunctions that you don't have to impose while the case is going through the courts. That's good. We've talked about Hobby Lobby and Conestoga, which the Supreme Court supported their religious liberty. These are for-profit companies. They're family-owned, so we'll see how that all gets to be lived out for other companies. But so these are the things we're working on, because as these cases move forward, these family-owned businesses, they call us and they'll say, are we cooperating in evil? And we have just heard a good explanation of cooperation. Formal cooperation where you intend the evil is never okay. Never okay. And it runs very close to what we call immediate material cooperation, where one is providing some material assistance that actually causes it to happen, like the anesthetist in Planned Parenthood. That would be a good example. Or the pharmacist who knows that Ella is filling that prescription knowing Ella is going to be used clearly as an abortifacient, providing an essential circumstance. Now, are employers actually engaged when they object in formal cooperation, when they say, wait a minute, we're going to go under at a penalty of $100 per employee per day? Is there a proportionate reason as we fight this to comply while we fight it? Are we engaging in immediate material cooperation? Are we causing something to happen? Or mediate material cooperation where we might make it possible? And we say we're probably in the area of might make it possible. We might make it possible. You're not causing that person to get their contraception. You've made it possible. And for proportionate reason, while we fight it, temporarily, it could be morally licit. More difficult to say with sterilization. A surgical sterilization costs a lot of money for a woman, not for a man. That can be, men can be done in an office visit. So would they have gotten it without that coverage remains unseen, depends on a case-by-case basis. Then you have, as Nicole has laid out, you can have immediate material cooperation, which can be justifiable. It can be proximate, like the pharmacy technician, who might be processing things, or remote, like the cashier taking the money for it. Both of those could be justifiable for the need for employment. They're not causing anything to happen. But where people call us is not just as employers, is this tolerable as immediate material cooperation as we fight this? And we think the answer is yes. People are now not getting insurance, and we're saying, oh, wait a minute. No, not having insurance is actually putting yourself at risk. And it's a proportionate reason to have that insurance. And at the same time, we're all cooperating in some way. I always ask the question, how many of you have cooperated in evil today? Any of you paying taxes? We're all cooperating in evil. It's what's tolerable. And are we causing something to happen or making it possible? And how close are we to making it possible? Which can be justified. But many times what's happening is they want us to be the principal agent as healthcare providers. They want us to be the principal agent or involved in immediate material cooperation. All was wrong. And so if we look at fulfilling the prophecy, and you have Humanae Vitae on your tables, this all was forecasted in Humanae Vitae. And if you haven't read it, you know, I was of a generation, the baby boomers, in which everyone was trying to justify oral contraception, and no one was really reading this document. And especially if you're a woman, you really need to read this document, because everything that was forecasted in this document about how this was bad for women and bad for society has come true. And then he goes on, Paul VI, to say about the mandates which then would be imposed upon us. So we have to be involved. Nicole is involved in terms of her professional organization. I don't know if you watch EWTN at all, but you will see Robin on it, a Women of Grace, 5 nights a week, a week in which she was on 5 nights. Did a fabulous job. She hasn't seen herself, by the way. She's told me she hasn't seen herself yet. But we have to be out there. We have to be out there. I was an elected member of the board of the National Council of State Boards of Nursing, which is the umbrella for state boards. We have to be there. But here's where you can take action. There's a National Committee for Human Life Amendment, which tells you how you can take action. The Catholic Nurses Association is going to be at Loyola meeting next year. Loyola University, I'm on the board there. Catholic Medical Association meeting in Philadelphia. We have to be there. We have to be there with each other, helping ourselves to protect our rights, to protect our patients, because that's what it's really all about. And I did it just on time, I think. Thank you very much for your attendance. We're going to move. We designed this so this last presentation, the Q&A was going to be part of the panel. So we're moving right into our panel so you can ask questions.